15-year-old bricklayer Kedley, who has a uncommon marrow carcinoma, is on to be one of the first UK patients to include positive proton-beam treatment, at a new devoted treat centre. He is start treat at the £125 centre at Manchester's Christie clinic. Previous, largest patients needy the treat had to journey overseas. The expert radiation therapy targets type of cancer out of injuring tissues about the tumours. The is nice for family who are at hazard of steady harm to security organs how are yet increasing, but it is accessible in just a fistful of countries about the planet. Bricklayer, of Angmering, Western Sussex, was undiagnosed in a marrow tumor in October. I had several headaches and belly effort and normal things, and got verify UPS at the doctors, he told. My mum told, same's not getting way or increasing. An MRI scanning showed he had a uncommon pylomyxoid astrocytoma marrow tumor. It couldn't be managed on since of a hazard of blind and some disastrous complications. This car is frightening since of its amount, he told. It's a bit nervous system racking, but the is a superior selection rather than chemo since it's more than efficient since of my year, doctor's mind emission would be a superior selection. Patients include been capable to journey across the sea for NHS underfunded treat with 2008. But several refugee been capable to journey since they are too ill or their treat requirement was too immediate. The journey as well inflicted main coup to families at a really tense period. The Christie Clinic Centre outdoor in fall 2018. The at first patient to include PBT down there, who is yet exposed treat, did not wish transparency. Other PBT centre is as well set to outdoor in the UK, at London's College School Clinic, offer the treatment of 2020. It is hoped how every will consider up to 750 patients each year. The Clatterbridge Carcinoma Centre in Merseyside has been supplying cheap energy-positive proton treatment particularly for NHS patients in eye tumours. But the two new centres are the at first to supply high doses to a more extensive band of type of cancer, consisting marrow, chief and cervix type of cancer and sarcoma, a uncommon carcinoma of gentle fabric. Both of will conduct out study to evaluate PBT's appropriateness for treat some type of cancer. Cancer specialist Gillian Whitfield is guideline bricklayer's thoroughness. She told his was a low class, sluggish increasing, tumor in a top opportunity of treatment. To bricklayer, in compare to usual radiation therapy, PBT should conduct a reduce hazard of several essential length-term party effects of treat, especially effects on brief-term RAM and training capacity, and the hazard above the following 8 many decades of the emission challenging some tumors. The is especially essential for family and younger generation in treatable tumors, who will pull through many decades following treat and are at lot more hazard of severe length-term effects of treat rather than adults. Bricklayer, who lives in his mom, father, and 4-person siblings, and is in the medium of preparation for his GCSEs, will include 28 treat sessions take location Monday to Friday for nearly 6 weeks. He has had a specifically done radiation therapy face mask created to hold his chief excellently yet for the treatment. And time he may get brief-term party effects such as vomit and headaches, length-term party effects are uncommon. And he told his experiences as a patient had affecting his next career plans. I'm so thankful to all the doctors implicated in my thoroughness, and I'd loving to do which they do one day, it will be my way of give everything behind.